Hello, my name is Alex. I'm a BSN1 student, and this is my patient, Lisa Malberg. Here's the paper, and do you give verbal consent?
Yes, I do.
Okay, now I'm going to be doing a 360 of scan of my room. Okay, and there's the floor, and there's the ceiling. Okay. Okay. Hello, my name is Alex. I'll be your nurse today. I've washed my hands, I've closed the curtain for privacy, and I'll apply gloves when necessary. Can you please state your name and date of birth?
Lisa Malberg, May 3rd, 1966.
Okay, and I will check your MRI number to make sure I have the correct patient, and I do. And today we're going to be doing the heart and peripheral vascular assessment. Can you please tell me if you have any history of CHF or arthritis?
No, I don't.
Okay, and now I'm going to be auscultating for any for the 5 heart sounds. If you could please take off your shirt. I'll be positioning my stethoscope in all 5 locations of the heart, and I'll be starting in the aortic area, which is located on the right side on the second intercostal space near the sternal border. And I do hear S1 and S2, or the leopard dub sound. Now I'll be going over to the pulmonic area, which is located on the left side, second intercostal space near the sternal border. And I do hear S2. Now I'm going to be going to Erb's point, which is located on the left side, third intercostal space near the sternal border. And in this area, if I heard anything, that would be signs of any murmurs. And now I'm going to be going to the tricuspid area, which is located on the left side, fourth intercostal space near the sternal border. And this is where I heard S1 the loudest. Now I'm going to be going to the mitral area, so on the left side, near the apex of the heart, at the fifth intercostal space, at the mid-clavicular line. And this is where I hear S1 the loudest. And now I'm going to be choosing one of the areas to listen for a heart rate. And I'm going to pick the mitral area, and I did hear a regular rhythm, so I'm going to be counting 30 seconds. And I'm going to be multiplying my findings by 2. Okay, and I counted 40 beats, and I multiplied that by 2, so it would be 80, which is normal, because the normal range is 60 to 100 beats per minute, and I did hear S1 and S2, and I did not hear any signs of S3 or S4 sounds. And you can put your shirt back on. And now I'm going to be assessing the upper extremities. I'm going to be comparing the arms bilaterally. And I do see that there's no signs of any redness or inflammation. And for the color, I do see that it is a tannish beige color with a slight color variation at the left wrist, maybe due to a Fitbit or a watch. And I do see that there are some primary lesions on the anterior side of the arm in form of a freckle. They're small and pinpoint in size and round. And I do not see any other signs of any lesions. And now I'm going to be testing for hand grifts bilaterally. And if you could please use my hand. Okay, and I did feel an equal and strong bilaterally hand grasp. And now I'm going to be inspecting the lower extremities. If you could put your leg up for me, please. And I'm going to be comparing the legs, comparing them bilaterally. And also for the arms, they are equal and symmetric. And also for the legs, they are equal and symmetric. And I do see that for the color, it is a beigeish tan color and no signs of any color variation. And now I'm going to be seeing for any primary, secondary, or vascular lesions. I do see that there are some primary lesions on the anterior side of both legs. They're small and pinpoint in size. They are round and they're on both sides of the anterior leg. And also before that, I will go to the venous patterning, and I do see that there is a sign of varicose veins when they are bluish purple color. And for the secondary lesion, there is one secondary lesion in the form of a tattoo. On the right dorsal foot is a large butterfly shape, and there's just only one tattoo. There is no signs of any vascular lesions, such as any bruising. And also for the legs, for the condition, they are clean, intact, and bilaterally. And for the hair distribution, it is clean and shaven. And for the hair follicles, they're evenly distributed along the lower and upper legs. And now I'm going to be palpating for edema and moisture. Is it okay if I palpate?
Yes.
Okay, and I'm going to be using my thumbs and going down distally along the tibial. I'm going to see if there's any edema or pitting. And I do not know any edema or pitting, and I did not feel any moisture. It was warm and dry. And now I'm going to be palpating for the posterior tibial pulse. I'm going to be using my index and middle finger. I'm going to be moving, going post-medial aspects along behind the medial malleolus. And I do feel that the pulse is regular, strong, and elastic, and I'll grade it A+2. And now I'm going to be assessing the dorsalis pedis pulse. I'm going to be in between the big toe, and I'm going to be going back, and I'm going to be feeling for the pulse. And I do feel that it is also a regular, strong, elastic pulse, and I'll grade it A+2. And now I'm going to be assessing for any ulcerations. I do not see any redness, lesions, or any ulcerations. And do you feel any numbness or tingling?
No, I don't.
Okay. If there was any numbness or tingling, I would know how far it went up, and I would know the physician. And now I'm going to position my patient for comfort. I'm going to put the bed in the lowest position. I'm going to put any call light and any items in reach. And I'm going to put the side rails up ×2, and I'm going to document my findings.